Schizophrenia is a complex neurodevelopmental disorder that presents with psychiatric symptoms, and those symptoms can vary dramatically from patient to patient. Hey everyone, I'm Dr. Michael Barnett, board-certified psychiatrist, and this is Schizophrenia Explained by a Psychiatrist. Here we go. Before I get into the symptoms, I want to clarify two misconceptions. Number one, schizophrenia is not multiple personality disorder. Number two, people often have a belief that people with schizophrenia are violent or aggressive in some kind of way. And you may be surprised to know that patients with schizophrenia are actually more likely to be the victims of violence rather than the perpetrators. So what are the symptoms? I break them down into 5 different categories. The first one being delusions. What delusions are fixed false beliefs that the patient will hold on to very firmly, despite evidence that suggests they should not. Next category is hallucinations. Classically auditory in nature, meaning you would hear voices, but can also be visual, meaning you see things that nobody else does, and even smelling, tasting, or feeling things. Third category is disorganized speech, which is characterized by frequent derailment, or generally being incoherent when somebody speaks. They can exhibit something called loose associations, which means that they can jump from topic to topic and the topics don't necessarily seem connected in any way. The next category is disorganized or catatonic behavior, which could either be behavior that seems disjointed with no clear intent, or catatonia, which is when somebody essentially shuts down and does not speak, move, or function well. Keep in mind, catatonia can also be present in other conditions that are not schizophrenia. Last category is what we call negative symptoms, and this has some similarities to catatonia in the sense that the patient will not speak or move much, and they will also have a diminished emotional expression. So how do we treat this? You guessed it, with medicine and therapy. And although admittedly medicine may be the superior treatment here, there is a lot of research that shows that therapy can also help, specifically therapies like supportive therapy and certain types of family therapy. And on the medication end, there are multiple medications that can give patients relief from the symptoms I mentioned earlier. But because these medications do come with potential risks, it takes a savvy psychiatrist to pick out the correct one and manage the correct one so that you only get a positive benefit without any negative.